When I thought about cancer, I always imagined it being a disease of old women. That, of course, was before I actually worked in a cancer unit and realized just how many young women are affected by cervical cancer in South Africa. I think the youngest patient I ever treated was 24 years old, with the average woman being in their 30s or their 40s. It's scary just how common cervical cancer is in South Africa. And unfortunately, most women present with advanced disease. And all this for a disease that is actually not only preventable, but it's easily treatable if picked up in the early stages. Preventing yourself from getting cervical cancer is actually quite simple. Firstly, don't smoke. Secondly, delay your first sexual encounter. Once you are actually sexually active, make sure that you are using a condom to prevent yourself from getting any sexually transmitted diseases. Make sure that your male partner is circumcised. And last but not least, make sure you vaccinate yourself against the human papillomavirus, which is a sexually transmitted virus that results in cervical cancer. Now I know, ever since the COVID-19 pandemic, people have been quite skeptical about vaccines, but you can be rest assured the human papillomavirus vaccine has been around for about 20 years now and has got some sound research backing it up. The South African government has a school program where they are vaccinating young girls between the ages of 9 and 15 against the human papillomavirus. And I just want to plead with parents not to keep your children away from school on these days, hoping that after this talk, you will realize the importance of this vaccine and the need to protect your daughter against cervical cancer. For those who are not eligible for the school program, you can get the vaccine in private between the ages of 9 and 45, as long as you are not yet exposed to the human papillomavirus. If you started engaging in sex in your teenage years, you are HIV positive, or you've been treated for any other sexually transmitted illness, you have pain when you're having sex, or you have a persistent discharge that smells bad, you have multiple sexual partners, you are a smoker, or you are actually postmenopausal, but you've started seeing your period again, I need you to listen closely because you might be at risk of having cervical cancer. I want you to go to your nearest clinic and get your pap smear done. Now, in the South African public sector, you can get a pap smear done from the ages of 30 if you are HIV negative, and every 10 years from there, or if you are HIV positive, you can get your pap smear done from the time you are diagnosed with HIV and every 3 to 5 years after that. Your results will take about 4 to 6 weeks to come back. Please make sure you go back for your results at your local clinic. Do not assume that the nursing staff will call you for your results, or that if they do not call you, it's because your results are normal. The public sector is overwhelmed and understaffed, so they might just miss your results if you do not go back and follow up on them. If your results are abnormal, you will then be referred to a district or regional hospital for confirmation of the cervical cancer and further investigations. There are 4 stages of disease in cervical cancer. So stage 1 being early disease and stage 4 being advanced disease. So ideally, we want to make sure that we detect any cervical cancer in the early stages. Treatment of cervical cancer depends on the stage of the disease. So this could be removing your cervix, your womb, chemotherapy or radiotherapy. Once you have completed your treatment, you'll still have checkups for the next 5 years. Please make sure that you do not miss these appointments because they are there to ensure that if there's any recurrence of the disease or if the cancer has spread to other areas in your body, this is picked up early. If there's any aspect of this talk that you'd love me to elaborate on, please let me know in the comment section. And if there are any cervical cancer survivors, please also hit me up. I would love to just hear from you what your journey has been like. And of course, do not forget to like, follow, and subscribe. Till next time, ladies, take care.